Hi, this is Dr. Jim Anderson, and I'd like to talk to you today about a topic that I think is fairly complicated, but I would like to try to give you some answers as to why you don't know about this. Oftentimes we have patients all the time that come in, and through the treatments that we offer, we're able to successfully reverse their restless legs or their neuropathy. And they're upset, they get very emotional sometimes because I may be their last resort. And it's interesting to be the one who may be their last resort to reverse these symptoms. And so for you that are listening, and maybe this is something new to you, you're going to be a little skeptical. And you're going to ask this question, which begs an answer. And it's a complex thing. And I may not have all the answers for you, but I can give you at least one idea as to why you're not hearing about this. Why it is that this is taking place, that every day in America, these two problems are being reversed, and you have no clue, you have no idea about it. So I think there's a lot of other factors. There's big corporate medicine, there's definitely big pharma, there's lots of reasons, but this is something I think's kind of interesting because I sometimes like to look at history. We can learn a lot from history, and so I'm going to go back in time with you back to 1924. And when you're talking about peripheral nerve problems, in other words, the nervous system that's outside of the brain and the spinal column, we find that there was a Dr. Galloway back in 1924 that was the first doctor to ever publish doing surgery for carpal tunnel. Now, a lot of you have heard of carpal tunnel. A lot of you may have even had carpal tunnel performed, and it's a very useful surgery for many people. It works extremely well, and it's something that most everybody's heard about. But remember this number, or this year, 1924 was when Dr. Galloway first described carpal tunnel surgery. Okay, so now let's step down to the lower extremity. 40 years later, 1962, Dr. Keck over in England wrote a paper showing that he was able to successfully open up the tarsal tunnel in the foot and help people. Okay, add that up. That's approximately 40 years later. So it took 40 years from the discovery of carpal tunnel to the discovery of a procedure to open up the tarsal tunnel in the foot. So guys, this is the same kind of tunnel. In other words, in the hand you're going to get burning, tingling, numbness in the palm of the hand. It's the median nerve that we're talking about up there. And down in the foot, it's the posterior tibial nerve. It's the nerve that supplies the bottom of your foot. So if you have a lot of burning, tingling, numbness on the bottom of your foot, there's a good chance you have tarsal tunnel. So that's 40 years. And I always say this to patients that come in. I really like to feel like myself and my colleagues are actually 30 or 40 years ahead of the rest of the medical community, because they are not trained to look at and evaluate these nerve tunnels from the knee down. And right now there's mainly 5 primary ones that we focus on all the time. And there's other videos that you can watch that will describe these and kind of give you a little bit more of the general concept. Another interesting thing I want to mention, if you dig deep and read this article, it's probably going to put you to sleep if you read Dr. Keck's paper. But it's interesting that 3 of those people out of the 10 had carpal tunnel surgery. And that happens a lot of times. People come in, they say, hey, I've got neuropathy, I've been told this, and I've heard you might be able to help me with it. Well, guess what? A lot of them have already had successful carpal tunnel surgery performed. Now they just got the same thing in the lower extremity. So follow along. I want to go back to 1924. Now there are multiple tunnels in the upper extremity. There's the ulnar nerve, the brachial nerve, there's other ones. And it took a little bit longer, I'm not sure the timing of all these, from 1924 on, before those were discovered and doctors are trained to evaluate them, and in some cases open the tunnels that become tight. And the same thing's happening here. Do you follow me? So in that length of time, more tunnels were discovered, a lot more attention was drawn there, and in 1962, same thing happened here. So again, I'm repeating myself, 40 years. Conventional medicine, I feel, is definitely 40 years behind the times. And so we have the first peer-reviewed paper to show evidence that we're able to reverse restless legs. And we have another paper that's the first one to show in the operating room objectively by doing nerve testing that we can have a very positive beneficial effect to the diabetic nerve so that we can reverse diabetic neuropathy. So, and there's lots more volume of information to demonstrate that we can reverse diabetic neuropathy. So the information's there, but conventional medicine remains 40 years behind the time. So a little bit of a historical perspective on this. I hope you learned something from that, and I hope that that gives you a little bit more understanding as to why all this is taking so long for you, the public, to hear more about it. So thank you for listening, and please comment if you'd like to on what you thought of this presentation.